This morning, we're looking at a problem many of us are all too familiar with this summer: mosquito bites. According to the CDC, more than 200 types of mosquitoes live in the continental United States. Some can spread illnesses like malaria, Zika, and West Nile, which is the leading cause of mosquito-borne disease in this country. Experts warn that rising temperatures nationwide could lead to an increase in the mosquito population. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF and an infectious disease specialist. Good morning, and just who we need to have here. So I've freaked everybody out now, but
good job.
What should we sort of keep our eye on in particular with mosquitoes?
Well, we are going to see expanding geographic spread of mosquito-borne infections. I think they're going to show on screen a map of where we currently have malaria, for example, around the world in yellow. In red, you'll see where by 2050 we expect to see malaria around the world, including in the United States. And you can see it's throughout much of the southern United States. So this is something we could be understanding. This is coming. We could be taking steps now to prepare better.
We heard about cases in the U.S. with malaria this year, which shocked me. What should people be looking out for to know, is this just a mosquito bite or is this possibly something more?
Well, first of all, is there transmission of malaria or dengue or one of these other severe infections in your area? This is what public health departments do. They look for this. And so they would be putting out alerts, just like we heard about malaria in Texas and Florida. So first of all, be out, look out for those kinds of alerts. Use things like insect repellent with DEET. Treat your clothing with permethrin. These are insecticides that can be helpful in these situations. And then do things like the health department does, which is to drain areas of standing water where mosquitoes can reproduce.
I feel like I'm itchy just hearing about all this. But in 2021, the first vaccine for malaria was approved. Can that vaccine help with those cases that you were mentioning in Texas and Florida?
It was approved in 2021, but for use outside of the United States and for a different kind of malaria than we saw in Texas and Florida. There are some mRNA vaccines. Remember COVID and mRNA vaccines? There are some in the works from malaria, but they're still in early trials and they're not approved yet.
How do we know? So with Lyme disease, people were told to look for the bullseye. Is there anything like that with mosquitoes to kind of know, okay, this is something more or this is something I should be concerned about?
Yeah, so unfortunately, the symptoms of many of these infections are quite similar, and they can also be similar to the flu or COVID, where you have fever, headache, muscle aches. Sometimes you might have a rash. Where I really get worried is, first of all, if you know there's transmission of one of these infections where you are, and then if you have symptoms like confusion, changes in your mental status, seizures, those would be indicative of something more serious.
And, you know, with people just even itching, things like that, home remedies, are there things that we can do?
Well, look, if home remedies worked, we wouldn't have 100,000 or hundreds of thousands of deaths from malaria and these other infections in places like Africa and Asia. So unfortunately, this is not a home remedy situation. For the itching, you can use topical steroids and over-the-counter antihistamines for some of those symptoms.
Just don't scratch, is what my mom says, even though I can't help myself. Dr. Celine Gounder, thank you very much. We appreciate you.